Hey everyone, this is Dr. Matt with the Ethos Athletes Podcast, and this episode starts our series on aging and what you can do to stop it. And for this particular series, I wanted to bring in my good friend Janet McConnell, who is a personal fitness trainer and owner of Galaxy Girl Fitness, as well as a bodybuilding competitor. Janet, welcome to the show.
Thank you.
So what we're going to discover in this series is all the different things that you can do to prevent aging, or a number of different things you can do to prevent aging with resistance training, essentially. And I brought in Janet because this is something that she believes in very strongly, and this is something that she's been very good at promoting with her business and her clients and the way she trains. And so, Janet, what made you become a personal trainer?
Well, I decided to become a personal trainer later in my life, probably in around my late 40s to early 50s, which is not very usual. I think most people decide when they're young. But I had been in corporate America, and during that time with business travel and being jet lagged and being very busy and stressed, I got really unhealthy. I gained a lot of weight, and I was desperate to change my life back to being more healthy. And so through that process, learned how to bring myself back to full health and strength and leanness. And it got me so excited because I wanted to bring that to the world and to other people who are like me.
That's awesome. Now, you've had this experience with bodybuilding competitions, right? Mm-hmm. Tell me a little bit, what got you into that? How have you done all that stuff, right?
Oh yeah, that's kind of a fun thing because in the beginning, I just wanted to lose weight because my doctor was breathing down my neck to give me prescriptions that would make me healthy. And I argued that I needed to give my body a chance to make me healthy again because I was an athlete as a little kid. I knew my body could do it. And so I asked him to give me 6 months to be able to get myself healthy. And if it didn't work, I'd take his prescriptions. So he said, fine, he gave in. And so I hired a trainer. And as I was training, I got strong. I lost 30 pounds in 6 months. And I went back to my doctor and he said, okay, all your numbers are normal. Keep going. Keep doing what you're doing. And we'll just go from here. But as I was in that process of working with my trainer, I started looking around me. And there were women who were my age who were lifting the same weights as I was lifting. And they were jacked. They were so muscular. And I said, how in the world? Why is it that they can lift the same weights I'm lifting and they look like that? My trainer said, oh, well, Janet, they're bodybuilding and they're going to be in a show in a few weeks. And I said, what is this bodybuilding competition thing? I've never heard of it for women. And he said, well, it's really hard. I don't think you want to know much more about it. And I said, oh, yes, I do. And so he said, well, really the difference is not only are you lifting heavy, but you also have to eat differently. So I said, well, show me what I'm supposed to do. And so he did. And I saw that really nutrition was the only thing standing in my way. So I was lifting regularly 3 days a week at 5 a.m. But it only took me so far.
Yeah.
And the rest of the way was nutrition.
Okay. Now, these last 2 years, you've been in a national competition, correct?
Right. I started competing about 15 years ago, dabbled in it, and then put it aside, and then built my business in personal training, and then realized that in order to inspire my clients and also to keep myself really on target with my own physique was to be a bodybuilding competitor again. So I found a trainer who would take me to a national show. And I competed 2 years ago at age 60 and got 6th place. And then this last year, 2 weeks ago, I just placed 4th in a national bodybuilding competition at age 62. So I was really excited, and I found that it really made me recommit. Every time I do this, I recommit myself to being as healthy as possible and to age in a very graceful and strong way.
Yeah, that's awesome. That's such a great story. Now, what type of clients do you typically work with?
Well, I do work with an entire range from 25 to 95. Right now I have a client who's 82 is the oldest I have, and 30 is the youngest I have. So I do train anyone, but my real sweet spot is people who are 45 and older. I have about 50% men, 50% women for clients right now. I find that the women who are 45 and older are especially looking for someone like me who was middle-aged, overweight, unhealthy, miserable, didn't feel good in my skin, and was invisible to the world because I just looked kind of frumpy dumpy and not healthy, kind of just invisible. And any woman listening to this who is in that state knows exactly what I'm talking about. So those are the ladies that I really like to help because I know exactly what to do because I went through it myself.
Yeah. Now one of the things, or the and you can correct me if I'm wrong, the platform that you've built your persona on, and what you truly believe in is the fact that resistance training helps with anti-aging, correct?
Yes.
And you see these individuals who they start to get older, and their mindset starts to shift, or they start to have these fears. What are you typically running across with these individuals? What's going through their head as they age?
Well, they're confused, especially if I speak specifically about women, because when we were in our 20s, all we had to do to lose weight was skip dinner and skip breakfast, and we could fit into and do lots of cardio, and we could fit into our little jeans again. And that's great, but that doesn't work after a certain age, because what that actually does is work in reverse. It makes you hold on to weight. So the women that come to me are kind of angry, confused, frustrated because the old tricks don't work anymore, and they in fact are digging themselves deeper and deeper into a hole. So what resistance training does is it builds muscle back onto their bodies that they've lost very slowly over time. It raises their metabolism, their base metabolism, and then they start to lose weight naturally just by eating a healthful diet. But there is some of the fears that are going through people's heads as they reach this place is it only going to get worse?
Yeah, absolutely.
I mean, I'm here, someone that's 40 or 50 is like, I'm not old enough to feel like this. So they feel like they see their parents and think, wow, loss of freedom to engage in the activities that they like, or diminished options and possibility for travel. I love to travel. What if I can't do it anymore? What if they fall down, they trip and fall and think, oh, I must be getting old. Well, in fact, everybody falls down now and then. But when you're fit and in shape, you fall better.
Yeah.
So you either don't break something or you fall in a way that you don't really hurt yourself, because you just have better balance. And just joints aching, and you start to notice those signs of aging, think, oh, it's just because I'm getting old. Well, no, it's because there's inflammation, and you can alleviate some of that through your lifestyle, not just through taking a painkiller.
Yeah.
So those are a few of the fears that people feel and experience, I think.
Okay. And so how do you go and shift that mindset for them? Well, one thing that I will say is I've seen a number of Janet's clients in my office for various health issues. They just started working with her, and they have joint pain or something, so they end up in my office and to come in to fix that. And everyone loves you. They love your personality. They talk so highly about how just how you are in session. So what is it that you're doing that is just making them feel so good?
I think because I enjoy the activity of it so much.
Yeah.
And I love teaching, so I don't just show them how to do the exercise, but as they're doing the exercise, I point out what they're doing. I'll actually touch them on their back or touch them on their shoulders to say, this is where you're supposed to feel it. This is what you're doing. Because I notice a lot of times clients, when they're working with a trainer, they'll be doing an exercise and say, what am I supposed to be feeling? Because it's been so long since they've actually activated that muscle or that area of their body, and they don't really know, am I doing it right? How do I know? So I really right away get their mind and their body to talk to each other, make sure that they're aware of what it is that what they're flexing, what they're working, and what they should be feeling, and ask them, are you feeling this in your lower back? Make sure you let me know, to make sure that because sometimes their core isn't strong enough yet, and I want to make sure that they aren't overextending.
Yeah.
So it's just I think that engagement, they love that personal attention where I'm just 100% focused on them. I create a bubble around us.
Yeah.
So the distractions of the gym around us don't enter in, and they feel completely that I'm at their disposal and I'm there to help them. So it's partly that I think people like learning about their bodies. They enjoy that the new knowledge about what's going on, and I'm just excited. I think it rubs off on them.
No, that's good. And I would imagine that the results that they see working with you kind of helps stop those fears that they were having that you talked about before. The fear of falling, not being able to travel, not being able to do what they love, right?
Right.
And it's really cool to see. I'm very fortunate to see these individuals when they start with Janet, and then towards the end, as they finish, or not finish, but as they've been in the programming for a while, they just their mindset and their attitude about themselves changes significantly. It's really cool.
They feel more powerful. They feel more in charge of their body, and they feel more engaged in what's happening in it.
Yeah, absolutely. So what kind of obviously resistance training is one of the things that you do. Is there anything? Is there any kind of special programming that you do with it, or obviously it's tailored for every individual?
Right. Well, I definitely find it a benefit to work with both you and with Dr. Tom Padilla, physical therapist, because when my clients see either one of you, I get feedback on, here's an area to be careful of. Here's something you don't want to do for a couple of weeks until it gets a little stronger. Here's a way to do this exercise. So I have like clinical underpinnings to what I'm having them do, but also just individualizing it. Excuse me, so that the client is getting exercise that is at their level, so that they don't feel like it's too hard. They just get to the point where they're just getting tired, and they can finish, and then they get stronger and stronger, and they see that progression.
Okay, yeah, that's great. Now, what happens? Let's say you are working with someone and they're progressing really well, and then they kind of plateau. How do you suggest our listeners kind of work through that with themselves? I mean, plateauing is probably the most frustrating thing for a lot of people. Right?
Yes, it is. It is. Well, there's a couple of things. One of the things is I make sure that they're training with me 2 to 3 days a week. Sometimes someone will come in kind of tentatively and just do 1 day a week because they're not sure. So you can definitely make more progress, build more muscle, get more strength and flexibility and stability with a little more time on it. And then another thing would be, I oftentimes, when my clients get stuck, I send them to Dr. Alex, a naturopath, to have their blood work done so that they can find out, is my thyroid working? Are my adrenal glands worn out? How is everything that I need? All the metabolic hormones need to be in place, because if you're dieting perfectly, your nutrition is on point, and you're training 3 days a week and you're still not making progress, sometimes it's something you can't see or feel, and it's just in the body itself. It needs to be readjusted. And then, of course, really coaching clients on whole foods nutrition, eating things that are not processed, making sure they get enough protein, not drinking sodas. And the hardest one of all is the battle with alcohol.
yeah, that's a big one for people, for sure. That's
a tough one. That's a tug of war.
Yeah. Are there any myths that exist when it comes to aging that you've been able to dispel, or you would like to say, hey, to our audience, if you've heard this isn't true? Right. What are some of those things?
Well, yeah, if you start listening to yourself or to people around you every once in a while, you'll hear things like that. Like, once you get past age 50, you really can't build muscle anymore. It's all downhill from there. And that is absolutely not true. You can build muscle. You can add muscle to your body. It takes a little longer to do. It's not going to be like when you're 25, but you can do it, and it's to your benefit to do it. It takes a little longer, and it also takes a little longer to recover. So building muscle after age 50 is absolutely possible, and I have the pictures to prove it from my bodybuilding show of competitors who are 70 and are just as buff as can be. Another one would be, at a certain age, you just can't fight weight gain. Everybody gets it. You get the little spare tire, the little muffin top, and there's no way to get rid of it ever. It's just on you from now on. All my friends have it. It's just inevitable. And that's not true. That little muffin top comes from too much refined sugar, too many carbs. And it's very easy to fix by getting enough calories, but just shifting what it is that they're eating so that they're getting fed, they feel full, feel satisfied, and just have to rely less on snacks that are just empty calories. And I would say probably the third one is, if I could get the motivation to exercise and diet like I did in my 20s, I could get back in shape. Well, I'm telling you, once you get progress and you put a little effort into it and you feel your body respond, you see the signs of something regenerating, you will get the motivation.
Yeah.
You'll feel like it's not possible as long as you're sitting there stewing about it. But once you have a little leap of faith in your body to move and to get stronger, and it responds, yes, I can, there's no stopping you.
Yeah. No, absolutely. Now, is it safe to say, or actually, how do you feel now at 62 compared to when you were, let's say, 25, 30, pick an age?
That's a great question. I feel stronger. I'm way stronger and way healthier than I was in my 20s. I think in my 20s, I was healthy, but I took it for granted and had no concept of maintenance and paying attention to my body and what was really going on. I just kind of lived on youthful vitality and ignorance, a combination of the two, and didn't really start gaining weight until my 30s. So then at 35, I felt pretty darn old. I have a picture of myself where people can't believe that that's me because I weigh a little over 200 pounds and I just look like, I don't know, just like a little librarian, to pick a really bad stereotype.
Yeah,
but,
no offense to librarians.
Yeah, right, exactly. But I just look like, I don't look like an athlete, let me put it that way.
Yeah.
And I felt older at 35 than I do at 62.
That's awesome.
Yeah.
Now, do you notice that with you? I know you work with primarily 45 plus, but the clients that you have that are in their 20s compared to their 30s, 40s, do you notice a mindset difference with them? Do they all follow that like ignorant vitality as the younger they are?
The ones that hire me have figured it out.
Okay.
They'll say things like somebody who's 30 says, "Wow, I really notice it now that if I stay up all night partying, I just can't pull it together the next day. I must be getting old." And you're like, "Oh, no kidding." Because of course.
Yeah.
So it's on a scale of that realization that time is passing and my body isn't like it was, but it's just at a lower level than when you're 70 and have arthritis and you really do feel like the ravages.
Yeah.
So somebody who's in their late 20s to early 30s has more recovery speed after a workout and can make gains faster because of that youthful vitality. But then they're only putting money in the bank for later to keep going so that they can avoid that going to their 20-year reunion and looking around them and saying, what has happened to us? It's the class reunion effect.
Yeah.
You see the picture and people all started out at 18 looking alike.
Yeah.
Kind of similar,
Yeah.
just young and happy and healthy. And then in 20 years, it's like, whoa. And so they're undoing that possibility.
Yeah.
So.
No, that's good. I mean, it's great to see that being able to reverse all that is is definitely a possibility, and you and the people that you've worked with are proof of that, right? And so that's really great. We're gonna go ahead and go back and just summarize the show really quick. And so we talked about the issues with aging and some of the things that Janet has personally seen in individuals who are aging, such as the fears of being able to not being able to travel as they get older, the fear of falling down. And I've seen that with a few of my older patients who have fallen down, and they've actually gone and said that they're scared at that point, like right. They have this legit fear of falling, and that these are all these are all things that can be avoided, and the research has been staggering on the benefits of resistance training to prevent this and kind of reverse these fears, reverse aging. And we're going to get into that in the rest of this series, where we're going to talk about the benefits of resistance training on metabolism, on your body, on your brain, and we're going to hit all those different points. So, Janet, before we end this episode, is there anything you want to leave our audience with?
Yeah, I think in general, to start out this series, one of the best things you can do for yourself, and this is what I tell my clients all the time, what everyone needs to do for living their best life until their very last breath is to pay attention. Pay attention to your movements, pay attention to your nourishment, and pay attention to your attitude. Because young people sometimes feel too immortal to pay attention, and middle-aged people are too busy to pay attention, and old people are too resigned to pay attention. But we all can have a mindset to care for our well-being by paying attention and believe in our life journey that you've gotten this far, so you are worth the effort.
That's beautiful. I love that. That's a great way to end it. So, Janet, thank you so much for being here. We'll have her on the next few episodes, but thanks for being here again, Janet.
Thank you very much.
All right, everyone. Thanks for listening. We'll catch you on the next episode.